In Egypt, mental health disorders remain a stigma. As a result, the country does not have accurate statistics on issues like suicide rates that occur from mental health issues. Nonetheless, the government and individuals have begun creating awareness on a digital platform, hoping to leave beneficial information online for people coping with mental issues. Adel El Mahrouky is following that story.
Suicide is among the top 5 causes of death globally. Assistance requires accurate statistics and social acceptance for mental health treatment. Egypt lacks both.
Unfortunately, the research about suicide is much less than what we would like it to be. It's frequent to see lack of information when a suicide takes place. According to WHO, Egypt is in the yellow line, neither high nor low rates of suicide.
We don't have an organization which is focusing on that. It's not realistic that in a country like Egypt, which has more than 100 million citizens, reports 5 to 7 suicides monthly. But we know that pressuring life circumstances is a factor.
Experts believe that spreading an acceptance culture of mental health in Egypt would significantly help people with suicidal thoughts.
The most vulnerable people to suicide are those whose social network are volatile or extremely small. That's a common feature among those who've committed suicide. More than 90% of them had mental health diseases, but they haven't been treated.
We are suffering from the extreme lack of awareness about mental health. If those who attempted suicide had found a kind of accessible mental support or social support, if they seek care and his frustrations are dealt with, I believe the rates of suicide will tremendously drop.
The National Mental Health Secretariat in Egypt has established a hotline to help people who are thinking about suicide. It has also been leading online awareness campaigns about mental health diseases.
Internet is part of the new generation's lives. They connect through social media. To them, texting is easier than talking. So all initiatives online are great. People can enter, view some useful information, learn about their mental status, and this can save lives.
There are other online private initiatives that are offering channels for people to learn and talk about their feelings and mental status.
On social media, such pages provide a chance for people to speak anonymously, which could encourage more people to talk, especially those who are still affected by the stigma mental health has in Egypt. Adel El Mahrouky, CGTN, Cairo.